The Center for Anti-Racism and Community Health is affectionately known as ARCH, and it really was created as an accountability mechanism, quite frankly, for the School of Public Health within the university, as well as, the university more broadly, to be able to actually undergo organizational change to begin to disrupt these white supremacy culture behaviors that are harming faculty, staff, and students of color, and our communities of color, whom we are collaborating with, and quite frankly, who we serve. I mean, we are here serving at the pleasure of our communities. Public health really is strategies, programs, approaches, policies to protect and promote population health. And when we think about racism and the effects of systemic or structural racism, it's really at that population level. And so that is another reason why public health is so essential as a venue to be able to start to disrupt these processes that are causing inequitable outcomes across these different segments of our larger population. If you have a policy or practice that's disproportionately harming communities of color, then it's racist. It doesn't matter whether it's intended to be racist. If it's having that impact, that's what's important. And we need to therefore be able to adjust or change or remove that policy or practice so that it's no longer having that impact. That to me is what anti-racism is. Starting off, our priorities are really to begin to build the evidence base about how are we actually going to disrupt these processes that I've been talking about. What are the change strategies that need to occur, at the organizational level, at the professional level, at the discipline level, and how can we begin to evaluate whether these strategies are effective, and how can we begin to disseminate those strategies. So that's the primary objective of ARCH, but in so doing that work, to be able to coalesce and nurture anti-racist researchers, and specifically Black, Indigenous researchers and researchers of color. We are an institution, and institutions are inherently racist. And we also have leaders within this institution who are committed to do things differently. And I think as we grow and we kind of spread that commitment, that's what's going to shift us and move us towards our transformation. I would see it about relationship building and trust building with communities, and actually establishing opportunities and structures within the institution to leverage the resources and the assets that we have here, but invite community in to be able to participate with us and actually make decisions about what ARCH is doing. We're really at this transformational moment, which to me is very exciting. Yes, it's uncertain, but with that uncertainty comes a lot of opportunity, an opportunity for innovation, an opportunity for thinking about things differently, because I think at the end of the day, it's about people. It's about caring for people. It's about partnering with people. It's about valuing people. I think that's how we're shifting population health.